Many states ending mask mandates and states of emergency. Life is slowly getting back to normal, but the lack of protection that masks and many pandemic-era practices provided is now causing people to get sick.
Not with COVID, but a recent uptick in cases of RSV, also known as the common cold. It has the CDC and doctors on high alert, even here in the Bay State. Western Mass News reporter Lena Jakowski is getting answers on what's causing the spread.
Masks are off.
Living life the easy way.
But that means colds are back on the rise. The CDC has issued a health advisory after a recent uptick in off-season cases.
Most of those are occurring in the South, but Dr. John O'Reilly, chief of general pediatrics at Bay State Medical Center, says he's seen a rise in cases locally too, especially in the last few weeks.
We've seen cases here at Bay State, and we've actually seen cases in the ICU.
While wearing masks hasn't necessarily weakened our immune systems, the severity comes from lack of exposure.
And so some kids are getting more sick with RSV than might have happened in a typical winter season when they've been exposed to 5 other viruses.
Young children are at highest risk since they've had less time to acclimate to viruses, especially after more than a year of isolation.
Last season, we saw almost no flu. So some kids got their flu shots, which is good protection and prepare their immune system. But kids who didn't get flu vaccine last year and weren't exposed to flu, especially in the, kids that are 1 or 2 or 3 that really haven't had that exposure, they're really going to be at risk next flu season when it does come around.
Dr. O'Reilly cautions that just because it's not COVID, we should still remain on high alert.
We've been so focused on COVID, and when we get a negative COVID test, we think, okay, nothing else can happen. There are other things that put our kids at risk, like RSV and bronchiolitis, and you want to contact your pediatrician because we're now moving to viruses beyond COVID.
And although symptoms for most are usually less severe, it can be passed to infants who are more vulnerable.
As we get into vacation season and travel season, it's the cousins from Georgia that might have a mild sniffle with RSV that are going to come to Springfield, and suddenly we're going to have an outbreak here.
But even after welcoming an infant into their family, residents we spoke with say they're taking the necessary steps to eliminate concern.
We had a baby great-granddaughter born during the pandemic, so of course we were very cautious because of her.
To prevent the spread of RSV, O'Reilly recommends practicing droplet precautions, such as coughing into your sleeve and wiping down contaminated surfaces. And if you're coughing a lot, to go back to wearing a mask. For Western Mass News, I'm Lena Jakowski reporting.